Welcome to True Health Tuesday. Today, spinal stenosis. Okay, tonight we're going to talk a lot more about the surgical intervention because this is the second time we've done this. So we got to do a little review on stenosis. And what's tough is you're going to learn about what it really is and the psychotic interventions that we're doing in the dark ages. Okay, stenosis just means narrowing. Okay, and spinal stenosis means we're narrowing the structures that hold the spinal canal, okay, that hold the central nervous system. Now, commonly in the neck, low back, pressures on the spinal cord, 200,000 cases a year. Okay, now this is the medical view, because you're going to see in actual fact this isn't what really happens. They call it age-related wear and tear, which is a complete lie. Okay, you're going to see that people in their 70s, 80s, 90s have not a stitch of degeneration or arthritis. That degenerative disc disease is not from wear and tear, it's from trauma. And it can occur at any age. Then we look, affects most people over 60. I'm going to show you a 2.5-year-old with stenosis. Now, the overgrowth of bone, arthritis, herniated discs, thickening ligaments, and spinal injuries. Now, this is something, because when we talk about wear and tear, it's not wear and tear. And I can't tell you how many thousands of patients I've seen. They come in there and then, they'll say, yeah, my primary doc, my real doctor, Bergman, my real doctor that I just came from, said, yeah, my pains come because I'm 60 years old and I'm supposed to have. That's ridiculous. Okay, my 98-year-old would love to shave 30 years off. So this is one of the biomechanics Bible. Punjabi and White is a good one, Kirkcaldy and Willis is a good one. But what they did, and this is a perfect neck. This is a neck that a teenager would like to have. He's 75. Okay, not a stitch of arthritis. And what they did is they took samples of bones from an old cadaver and samples of bones from a young cadaver, put them through compression and torsion tests, and they found out that they're the same. Old bones react just as well as the young bones. So when I'm 57 in a week, I'm okay. But what that means is that age-related wear and tear is a completely false bullshit answer. Okay, it's not. The body is designed to be healthy. We're supposed to be over 100 years old and healthy. So what causes it? What causes that trauma? Well, this is going to blow the mind of some medical doctors and people that are in the dark ages. Imagine if the body does something intelligent. Okay, now we're going to look at the disc over and over again. You're going to be like, Jesus, Bergman, we heard it before. You got a bone up here, a bone down here, and a disc in between. A disc has a horrible blood supply. It gets most of its nutrients through movement, which creates an imbibition. So it sucks it in there. Because, if you figure all the weight on a human disc, the blood vessels would be crushed. So it gets its nutrients through movement. Now, what we're looking at is grade 1, grade 2, and grade 3 arthritis. And it's called disc degenerative disease or osteoarthritis. Now, you'll see in the first one, the bone or the structure has lost their normal position and motion. That's grade 1. There's no destruction of the disc, no destruction of the bone, super easy to fix. But what happens if you've lost that normal position? Is the body smart or stupid? It's smart, yeah. So the body, it doesn't want those nerves impinged. Now, this is the side view of a neck. So you're talking the cardiac and respiratory center, the phrenic nerve is in there. There's a lot of very important structures. So if that structure is deviated from normal, the muscles are going to tighten up. Now, tightening up, does that help range of motion or limit it? It limits. So that decreases the nutrients that are available to that. So that beautiful bone, beautiful disc in between, it starts to get compressed because it's not getting the nutrients. Now, that creates instability. Okay, so it's not stable. So what the body does, it starts to change the bone shape. Okay, where that disc is. It literally increases the surface area for stabilizing. So this isn't degenerative disc disease. This is an intelligent stabilization of an unstable structure in order to keep the nervous system live. Without that nervous system, you're dead. Okay, so this is not osteoarthritis or degenerative disc disease. This is a brilliant stabilization after a trauma to keep the body alive. Now, when you look at this, we've got all of these ridiculous categories that people put in, like normal, alteration of motion, you start to get some degenerative changes, bulging disc, slip disc, herniated disc, they're all basically the same thing. But when you look at the disc is 80 interconnecting rings of ligamentous tissue. It's the toughest thing you ever saw. I mean, what we used to do in the dissection lab, a probe looks kind of like a pen. You could pass it through bone easy. You can't beat it in a disc with a hammer. I mean, imagine 80 rings of fiberglass. It's phenomenally tough. But what you're looking at here on the skeleton, that's an actual x-ray. You're seeing where that bone has a curve, because the neck is supposed to curve in the front. There's no degeneration at those two bones. Where the curve in the neck is backwards in the red area, there is degeneration there. And so many times, a patient will say, yeah, my doctor says it's deteriorating because I'm old. I said, well, the other two bones are young. They're just fine. Do you know what I mean? There's no common, and I finally figured out the term common sense, because you can't say that anymore because it's not common. Does everybody agree? Okay, so the new term that we used to call back in the old days common sense, it's now uncommon sense. Okay, because this is uncommon sense. So this is what is a distorted view from the MRI, and I'm going to say distorted view because an MRI is in the middle. An X-ray is on the other thing, and even an X-ray is distorted because what we're looking at a shadow of a three-dimensional object in 2 dimensions. So you're looking the positioning is vital, the movement is vital. I'm going to show you what stress X-rays are to accurately diagnose stenosis or a problem, because stenosis, remember, that just means a narrowing. Now the structure in the middle, or the picture in the middle, is a magnetic resonance imagery. Now this is held like gospel in today's society, that you put a human being in this structure, a big magnet zips around and places all the hydrogen ions in one position, and a computer interprets this. Now you get a really pretty picture. But inflammation can distort that interpretation, okay? Positioning of the person can distort it. So when a lot of people, they'll bring me reams of information. Oh, I've got these great MRI reports. And I'll say, well, was the MRI done with you sitting up or laying down? If it's laying down, it totally distorts it. So what happens is, now this is a spine, okay? The normal curves of a spine, and all I did was bend it, in, say, the person's laying down and their back face up. And you'll see it's not flat. You got a sacrum way down on the left-hand side there, and if you're laying down on that sacrum, what's going to happen? The table's going to be pushing up. You've got a thoracic area that comes out in a kyphosis. If you're laying down on that thoracic's going to be pushing up. And if you're laying down the cervical spine, that head's going to be throwing it down. So you're completely distorting the natural structures, and you're going to get a distorted image. Does that kind of make sense? And now Stephen Brownstein, okay, he wrote the foreword on the Essentials of Skeletal Radiology. Significantly more pathology is discovered through an MRI scan done in a patient standing neutral or standing in extension compared to the conventional MRI when which patient is recumbent. That's because when you're standing, okay, or bending forward or bending to the side, you're massively changing the force loading on the discs. Okay, does that make sense so far? Because it's huge that people are forgetting to look at why. See, the spine works in conjunction. I mean, there's multiple segments together. So what would cause one disc to herniate? They don't ask that. I mean, 50% of low back issues are coming from some other area, like the neck or cervical spine or unstable pelvis. But typically when you get this radiating pain and they go in there and they say, wow, you've got this disc damage, it's causing a narrowing of that spinal canal, it's causing all these symptoms. Oh yeah, well what happened? Oh, age-related wear and tear, we already know it. But it can't be. So when you look at this, I want you to own that that disc is incredibly tough. It lasts for a lifetime. It never deteriorates because it's constantly renewing. So it would take years of damage or years of an altered trauma in order to have that disc become defective enough. Now, the most frustrating aspect of this is the function on the autonomic system. Now, 90% of the nerves that come off of the spine, there's no pain fibers. So when we're talking stenosis in the medical world, remember, we're talking dark ages, so there's no uncommon sense there. I just used the term. Yeah. So but when you think about it, okay, so if that's causing pain anywhere in the body is going to trigger this automatic response. And we've got two halves of the automatic nervous system. Okay, one part keeps you alive under stress. That's the sympathetics. The other part regenerates tissue. That's the parasympathetics. So if you're being chased by a tiger, you do not want blood going to the digestive tract. You don't want it going to the immune system. You don't want it going to hair or skin production. Okay, those are non-essentials. If you're under stress, you want the blood to go to the arms and legs. You want cholesterol to be elevated because that's where the hormones are going to be made. You want the heart rate to be elevated. You want the liver to start breaking glycogen down to glucose, all under this stress. Now, 90% of the nerves that come off the spine, that if they are stenosed, you don't even feel. So how about let's look at stenosis as a different aspect. So a scenario for you, somebody gets into a trauma. They're sitting at a desk, they fall off a bike, they get into a car accident. That causes an alteration. What happens? Stiffness and tightness. How many people have woken up with stiffness and tightness and they think, oh yeah, I'll just stretch it out, it'll go away. Well, you don't even have conscious control of the muscles that run down either side of your spine. They increase in tone under proprioception. So that stiffness and tightness should be a major, major warning light, but we don't have respect for the body. You know, so, but if we do have respect for the body, we understand that even an alteration in cholesterol or an alteration in blood sugar or an alteration in tone of the muscles is a clue that the body's not functioning right. Okay, does that make sense so far? Because this is the medical system. Stenosis, oh, pain. Really, 90% of the nerves come off the spine, and you're not going to tell me that high blood pressure, which is a result of a sympathetic dominant state or a fight or flight state, couldn't be coming from a stenotic spine. I mean, come on, guys. You know, impaired bladder control, bowel control, well, that's at least a positive. They're looking at something else. But remember, the nervous system controls and coordinates every function of the body. That nervous system we're talking about can go through a canal that's stenosed or smaller, that's choking it off. That can alter every function of the body. So what do you do if you have an alteration in the body? I know, shoot it with a shot, some steroids. No, man, this is the dark ages. I know it's not going to make sense. Okay, so you might be worried because they have a warning on the shots. You can only do about 4 of them because it starts to deteriorate the bone, the cartilage, and everything else. What kind of asshole would want to shoot this in a disc anyway? Hi. We know there's a mechanical distortion of the spine. We know that the disc is starting to deteriorate because it's not moving correctly. So we're just going to drug you to make you comfortable while it rots out faster. Yes, the steroids are going to rot it out quicker, but you'll feel so much better. Steroid injections don't work according to the Mayo Clinic. Well, they don't last for a long time, and any repeated steroid injections can weaken the nearby bones and connective tissue. What guy would, you know? Okay, well, we can remove the offending organ because this is the dark ages. Cut out the lamina, and I'm going to show you a couple of case studies in here. But, you know, surgery, how effective is it? Well, 600,000 people a year minimum undergo it, a cost of a little bit over $6 billion, and the return to work rate is about 15%. You can read that backwards. 85% don't go back to work. And they have a failure rate of between 75 and 80%. Why is it? Is it because they're not looking at the cause of that disc damage, that they're looking at an MRI which is distorted? Why are they doing this? $6 billion reason, okay, that's probably why. But again, there's not that uncommon sense. Okay, I mean, Some people's symptoms stay the same or get worse. Surgical risks include infection, tear in the membrane that covers the spinal cord, blood clot, neurologic deterioration. How about regenerating it? And this is one of the most frustrating patients. I mean, she is just a doll. She comes in on the left, no surgery. I say, yep, we can help you. 2 adjustments later, her arm pain's better, neck pain's better, she's feeling way better. Okay, but she can't continue the care to do the correction. Why? Her insurance doesn't cover chiropractic. Did cover the surgery though. She comes back 9 months later, she says, Doc, I went and got that surgery, I wish I hadn't. Now I got neck pain, arm pain, I can't sleep or anything else. Okay, but can you see that, well, I mean, the surgeon screwed up too. You're supposed to fuse these things in a curve so it deteriorates it less, but each of those segments is supposed to move. And if they don't move, the area above and below have to move twice as much. So it's guaranteed to wear out. That's why surgeries don't last a lifetime. I mean, they typically are going to deteriorate the structures above and below. And I mean, luckily we were able to help her, but the real cause of her problem was up in the rib cage area, the thoracic area. Here's a gal, 7 back surgeries, and you're looking at fake discs on the left, bolts and screws going in. We're looking at an entire metal aspect up here in the front, and she only has 1 movable bone in the neck. And I know what you're thinking, what do? You move the 1 bone. I mean, luckily, if you got a situation like this, you got to have a chiropractor that's skilled in moving the upper cervical, but we are able to help her. But still, where's the logic in this? What brought these people to this point? I mean, I can understand that if you're in a crush injury, you've had an auto accident, you were run over by a car. I mean, I really understand if you're run over by a car. Really, really. I mean, if your bones are crushed, it's the best thing in the world to have a surgery. But to get a surgery because you have neck pain and arm pain and you haven't even tried conservative care is foolish. So what do we have? It fails so often, there's actually a billing code called failed back surgery syndrome. I know, I see this and it's like, are you serious? Okay, it fails so often we got a billing code for it. It fails 80% of the time. By far, the number 1 reason back surgeries are not effective and some patients experience continued pain after surgery is because the lesion that was operated on is not in fact the cause of the patient's pain. Okay, so the next 1,000 people that bring me an MRI of you in the supine position, and I say, no, it's not really important unless there's a tumor or something on there, this is what I mean. Okay, so if you can't utilize an MRI, 80% of the time it fails, surgery is not really an option. What do? This is what you do. Okay, and this is how to find, it's called a dynamic stress x-ray. Yes, you're looking at bolts, screws, pins, this is metal stuff, and a fake disc in a human being, okay? Now, this is one of the worst surgeries because when you have a lumbar spine, it's supposed to be separated from the sacrum by a disc. Barbarians are going to bolt the lumbar spine onto the sacrum. That creates a completely unstable, biomechanically abhorrent situation where the sacral iliac joint on either side of this is going to be completely unstable, and so this person is going to have chronic sacral iliac instability. That means sitting for long periods of time, standing for long periods of time, bowel and bladder problems, everything. But guess what? They underwent the surgery, they still hurt. So what we did is actually bent their spine. They're there standing, bend it to one side, take a picture, bend it to the other side and take a picture. Now, as you can see here, when you bend off to the side like this, the spine should move the way you would think. Okay, you should see a narrow disc on the concave portion and a wide disc on the convex. What we're seeing here is 2 discs that are wide on the concave portion or the inside portion of the curve. That's an abnormal disc function, or you could say disc bulge, herniated, slipped. It's just abnormal because none of those terms make sense because the disc motion here, it's altering the disc, but ultimately this is a function of what's called proprioception. And this is way beyond the Dark Ages mentality of, ooh, it's bad, let's cut it out, it must be horrible. Okay, I know. This is looking at more, wow, there's an alteration in proprioception, or how the brain views the environment through multiple physical, chemical, or emotional stress loads, and it's causing an alteration. So when I say the disc motion isn't correct, okay, they say, well, what is it, doc? Is it slipped or herniated? Yeah, whatever you want, use an adjective. It's just not working right, okay? And honest to God, that is the best answer. Now, here's a guy too that's perfect. Multiple areas of trauma. Okay, luckily we got to him before the surgery. On the bending, you're looking at 3 discs on that left aspect and 2 abnormal discs on the right. And luckily we were able to help him. You know, because what can you do? A disc is living tissue, right? If you distract it, you're creating a negative pressure on that disc that allows nutrients and fluid to flow into it. If you can cause an inflammatory response, cause inflammation of the disc, you can regenerate the disc. So what's the cause of stenosis? Trauma. The disc doesn't get movement. The disc gets compressed. Okay, what's the solution? Increase inflammation in that area, realign put it in the correct position, and cause that disc to regenerate. And then bone spurs go away, everything. It's correcting the cause of stenosis. When you hear this stuff, you think, why aren't you guys correcting the cause? Here, perfect, 100% loss of curve in the neck on the left, numbness and tingling in his hands, high blood pressure, I mean, all the symptoms. And he's got pretty significant degeneration, so what do? Take a stress x-ray. Wow, buddy, your bones still move, the discs are still viable, we can get this corrected. So how do you correct it? Get the curve back in the neck, cause an inflammatory response, it regenerates. Here you go, on the left, this is that white thing on the bottom, one of them, is a fake disc they had put in their spine. And you can see that the spine on the left is not straight, it's bent off to the side. Yes, they had back pain before the surgery, they did the surgery, they still had back pain after the surgery. It turned out that up in this area, God, I wish this thing worked on a... But you can see how it's bent off to the side, that's where their pain was. So the after picture where the spine is straighter, that's after a correction. I mean, think of it, it seems too simple. You got a vertebrae, a spine that's supposed to be like this. It's like this, that causes a stenosis action, okay? It causes a bone not to be in the right place. It's gonna cause an alteration in movement that causes an alteration in nutrients going to the disc. The disc is gonna get compressed. The body is gonna increase the surface area by laying down extra bone to stabilize it. Doesn't that seem like an intelligent response? So what do? You reposition it, you cause an inflammatory response, those cells initiate growth, and they regenerate. This is a crime. C-section induces 4 times the amount of pressure on a child's neck. Okay, the rate should be about 6 to 7% max. Okay, we're up to 50% in Florida. Okay, it's C-sections, because why? It's quick, it's easy, it's dirty, let's just traumatize the kid. This is a reverse curve in the child's neck. Okay, and what was the cause of stenosis? Age-related wear and tear. Okay, yeah, I know, it's psychotic. We look at normal on the left, we look at this poor little 2.5-year-old kid, and of course, under that much influence, that negative influence on that kid, he's in chronic pain. Of course, ear infections, which weren't ear infections, they were ear effusions, fully vaccinated, so we shot him up with about 36 shots, skin issues, allergies. I mean, it's inconsistent with normal. Okay, so we have to fix it. Here's another guy. Those are 2 steel rods coming up here for a scoliosis surgery. He had a 21-degree bend down to 6 degrees. We can't work with the steel rods, okay, because my power tool would get, no. No, it's just not appropriate. See, when they put in steel rods, they have to remove some of the bone. So a lot of times you can't remove the steel rods. Sometimes you can. So now we're talking about a mechanical distortion of the spine causing less nutrients going to the disc. That causes the disc to lose its integrity, okay, causing pressure on the nerves, causing discomfort, okay? So let's drug it. It's just, in my world, it's so far afield from common sense. Let's drug it? Okay, now non-steroidal anti-inflammatories, most common around there, used by almost everyone. They inhibit proteoglycan production. They're the building block of cartilage. They stop the body's ability to regenerate the disc. But yes, you'll be comfortable if you take these. Okay, there's a ton of other anti-inflammatories that you could take that facilitate the healing and don't stop it. But let's not stop there. Okay, you got stenosis, you take the non-steroidal anti-inflammatories. What does it say on the label? You can have cardiovascular problems, gastrointestinal bleeding, ulcers, kidney problems, increased blood pressure, 107,000 hospitalizations per year, and about 18,000 people die. Okay, that's not good. I mean, and then atrial fibrillation, 76% increase. It's foolishness to give a little drug that causes poison and discomfort, okay, and destroys the body, for the body giving you a signal that says, hey man, there's a problem. Okay, it's crazy. But these are the most common drugs prescribed in America, and they're over the counter. Cardiovascular problems, hearing loss, abdominal pain, vomiting, 7,000 hospitalizations a year, congenital heart failure, allergic reactions, asthma, 80% miscarriage. Okay, it's crazy when this is the structures we're working with. I mean, if you've ever cut open a human in a classroom setting, no? Okay, well, it was really, I mean, for me, it was the most wonderment that you could imagine. Because when you look at these structures, this picture on the left is literally what it looks like. You see this living structures, and it's alive, okay? It moves, it bends, it regenerates. And I had this orthopedic surgeon one time whose hands were going numb. He had a reverse curve in his neck. I said, yeah, doc, luckily, the extension film on your neck showed that it moves, so, we can regenerate the discs. He said, regenerate discs? I said, yeah, doc, they're alive. I never really heard that. Okay, so this is what you got to do. You got to walk people through this. Okay, is it living tissue or dead tissue? Okay, doc, do you have dead tissue in your body just kind of hanging out in your neck? Well, no. Okay, so it's alive. We can agree that it's alive, yeah? So that means it's got to take in nutrients, eliminate waste products, and it has a metabolic process going on. Well, yeah, I never thought of it that way. Okay, so it's living tissue. So how about we cause inflammation? Cause inflammation? Yeah, cause inflammation because we're going to actually initiate more metabolism there so we can regenerate the disc, and that's going to reverse the stenosis. Really? Okay, so the real cause of stenosis is arthritis, and arthritis we know is a protective thing. Herniated discs, ligaments, spinal injuries. So what's the solution? It's literally reversing the arthritis. Put those bones back in the appropriate position, change proprioception, get the body working correctly, restore and regenerate the disc, change the tension on the ligaments so they regenerate themselves healthy, and correct the structural damage. I mean, this is how the spine is supposed to be. The curves give the spine strength. Movement gives nutrients to the discs. I mean, correct movement, correct position, that's everything. The most frustrating aspect, though, if you alter position and motion of those vertebrae, you alter communication to the brain. And that is everything. I mean, typical guy. Dave, you're talking 10 different medications. Obviously, he's not healthy. Okay, but in this psychotic culture, his body is presenting with symptoms consistent with stress. Does his spine look like it's under stress? Absolutely. So what's going to happen? Let's just say that stenosis is altering his autonomic nervous system. His body's responding correctly. He's supposed to have high blood pressure. He's supposed to have high cholesterol. He's supposed to have elevations in blood sugar. He is under stress. He can't sleep correctly because, by God, he's got to protect the cave. So he comes in here still hurting. So, bam, let's just fix him. Doesn't that make more sense? you know, respecting the body, it just makes sense. I mean, we're talking obviously, and instead of saying this person on the left looks like they experienced some trauma in the past, okay? Are they hurting? Yeah. Acupuncture is not going to help it. Okay, it'd be good with the symptoms. How many people want to give them a good goji berry salad? It'll help, okay? Except he's not going to get the nutrients, he's not going to get the absorption. You know, how about we just fix the structure, appreciate that the body's in a stress aspect, he's going to get his sleep, he's going to get the blood pressure, everything's going to start working right. Again, we got loss of curve in the neck to normal curve. This curve in the neck is called the arc of life. We've got multiple sclerosis, okay? 69-year-old guy. Now, is MS, knowing that 80 to 90% of MS, multiple sclerosis, is remitting and relapsing? Do you think that maybe we could have relapsing and relapsing if we change the structure? Okay, and alter the brain's influence of the body and the nervous system, how it regenerates? It just makes sense. And we're looking at 19 degrees to 12 degrees. He's still messed up, but at least he doesn't have high blood pressure, he doesn't have high blood sugar. I mean, here you go. Now, this is a crime. I asked him what to call him, and it's Peter. Okay, so we're going to call this guy Peter. The surgeon fused this in a reversal of the curve. Now, he didn't fuse it in a normal curve, he fused it backwards. Now, it caused so much damage here, he removed these parts of the bone. They're called the spinous process. He just took them out. Yeah, because, you know,
when in doubt, take it out.
When in doubt, take it out. That works for cleaning garages and fusing spines. We got the same sense of humor. Okay, yeah, so when you look at this, we see surgical screw-ups all the time. Okay, so maybe I've got a prejudicial nature because I see this consistently, I mean, horrible. Here's a gal, we sent her back because they fused her spine, and you can see on the left, that's when she first came in. And the brain functions like a battery. If you alter the motion, the brain's going to initiate motion to create dopamine. And if you can't move your spine, you're going to have this type of motion. A year before the surgery, she could carry a sack of concrete across the garden. That's what she's telling me. And now she can barely walk across in here because she's shaking to try and get some stimulation up to her brain. This is, those are the rods, bolts, and screws that they took out. This is, again, her before and after neck that luckily, it wasn't the same surgeon that took the stuff out that put it in. Okay, this was just, I mean, a kind-hearted soul who had, you know, some uncommon sense. He thought, yeah, you know, I think you'll probably do better if we remove, you know, a foot or so of this metal. And luckily she is. Her shakings, you know, decreased dramatically. So what's the solutions? Okay, if you're hurting, you got to find the reason your body's hurting, but also look at it a little bit more in depth. Okay, what about, is high blood pressure the cause of stenosis? Is any of those stress responsors a cause of stenosis or a signal from the body? So could this be elevation of blood pressure, elevation in cholesterol, poor sleep patterns? Okay, all of those things, could those all be from some type of nervous system impingement causing an alteration in function? Okay, doesn't it behoove you to like respect the body and get that friggin' thing solved? So here's a list of natural pain relievers, and when I say natural pain relievers, okay, I want you to understand what pain is, okay? If you have an inflammatory process, that's the body breaking tissue down, that's called oxidation, you're breaking tissue down, and by breaking tissue down, you're actually creating free radicals. Now these free radicals can cause residual tissue inflammation, they can cause a lot of damage. Now, in stupid world, you take a non-steroidal anti-inflammatory to stop that inflammation process. In smart world, you understand that that inflammation process is how the body regenerates brand new tissue. Okay, so what we do in Smart World is we give you antioxidants, things that can give up extra electrons, so you make that inflammation or that inflammatory process more effective, so it actually regenerates tissue. Doesn't that make sense? That's why when I'm talking about natural anti-inflammatories, I'm not trying to decrease the inflammation, I'm trying to get the inflammation to do the job it's supposed to do. Okay, to regenerate your tissue. I mean, if you look at it, boil it down to, simplified, cytokine 6 they're inflammatory cells. They got to get in there and destroy this old bad tissue to initiate these cytokine 10 cells, which regenerate tissue. Okay, you can't get just cytokine 10 cells to work unless the cytokine 6s destroy it. You can't build a building on top of this one until this one gets knocked out, okay? And so we're talking omega-3s, boswellia, curcumin, cayenne pepper, vitamin D, astaxanthin, ginger, bromelain, fresh pineapple, great pain relief. But they're all the antioxidants that allow your body to go through the process. So when we talk about, the 5 keys of health, this is exactly what we're talking about. You got to get the nervous system checked. How do we check it? We look at the structure and its function. Exercise, it moves the body, phenomenal. If man makes it, you don't eat it. Sufficient rest, this is how your body regenerates, and prayer and meditation. Now we have a new website. Has anyone seen this one before yet? It is bitchin', okay? And I actually found out that term isn't common anymore. No, seriously. But I've used it for so long, it's normal in my vernacular. Okay, so I just say Boulder Dash to that. Okay, but this one, no membership. It's got the neatest thing called the disease database, where you go in there and we're always adding to it. So, you go in there on any disease that we've got up so far, and we're going to continue to build on it. It tells you what it is, where it came from, and then the solution for it. Handouts, PowerPoints, everything. This is really a fun site. I've been wanting to build this for a while. And we got, for all the internet trolls, references. Okay. Now, any questions?
And so obviously, when you go into these MRIs, I had a herniated disc, and when I showed you the MRI, you're like, it doesn't even matter. And when I told you about the report, on the report, L4, L5, mild stenosis, L5, moderate stenosis. Well, can you just go into real quick why they're indicating these problems and the training behind the people who are because the reports are just garbage, right?
Complete garbage.
Can you just go?
Yeah, it has to do with the way the spine is being looked at. And there's 4 different problems with an MRI done in the supine position. An MRI in the weight-bearing position is okay, but kind of not really. Perfect example here. Okay, put this guy with that lateral deviation of the spine under an MRI. So a normal body is here. We've got the curves on the side, okay? Now the head is supposed to be over the base. Now he's got pain here. So we're not going to look at the lateral deviations here. Okay, we're not going to look at the front even though he's got a lateral deviation at the junction of the rib cage. He's got pain down here, but can you see this? The entire torso is put off of the center location here, but he hurts here. No kidding. He hurts there. Why does it hurt? Why did the disc damage? Okay, what's the aggravating factors? If the head is forward, you got this 15-pound head that's gone forward. Okay, that can be a contributing factor. Even if it was a football trauma and you were hit here, could there be secondary traumas up there that were missed? Absolutely. It's called holistic, but it's absolute basic common sense. And then you take that twisted up mess and you lay it flat. So now you got the thoracic pushing up here, you got the pelvis pushing up here, and the head pushing up here. And then, let's say it's even inflamed. Inflammation distorts the MRI. So, and then I think they pay the docs, I think it's $12 per MRI, and there's 80 films. Oh, it's ridiculous.
The people who read the report and then enter in information.
Horrible. Oh, yeah. I get that all the time. They got about 8 to 12 minutes to read, what are there, 50 pictures in an MRI? Yeah, we get mistakes all the time. Okay, and so I'll look at the report, I'll say, yeah, you know, can I have the pictures? Yeah, and you see mistakes all the time. It's just not accurate. Yes, ma'am.
What do you do to induce the inflammation to cause the healing?
Adjustment.
That's just an adjustment.
Yeah, yeah. If I'm good.
I know.
No, but it's just and look at it, just force, okay, directed in an appropriate direction, in an appropriate line of drive, will move that over into the right position, and you're going to inflame certain tissues. If you cause too much inflammation, it's going to be uncomfortable. Too little, we're not going to get the effect. So it's a balance. Yes, sir.
When you cause inflammation, does that mean there's going to be pain during the healing? Will there be like a healing crisis?
Not usually, because most of the pain from a subluxation or from a stenotic spine is going to be from the secondary muscle spasms around it. You know, I mean, you can have like the sciatic nerve, which has got 5 different root nerve origins, have one of those, you know, impinged, and it'll be radiating down. But then that's going to cause an altered gait. It's going to have a lot of secondary problems. What we're doing, we're taking the pressure off of those. We're separating those bones, so immediately it feels better. Okay, and then we cause a disc. We'll stabilize the pelvis, and then, you know, if anything, we're looking for centralization of symptoms, but, you know, it doesn't take long. Week, 10 days, 10, 15 adjustments. You know, symptoms start to go away.
Let me just ask you, when you drink water in between your adjustments, is it hydrating the disc, or is it moving the inflammation out?
Yes, everything. Both. Yeah, because we ask people to drink water in between the adjustments to take care of some of the free radicals, hydrate the disc, get your body in there. And honest to goodness, water is one of the best pain relievers out there. And the discs are 70% fluid. So how many people are dehydrated? A lot of pain relief is done by getting someone properly hydrated. Now, next week, Dr. Mike's going to be talking about cannabis, ancient medicine for a modern world. And will be legal in California.
You have apples?
No, I was saying it as